Thanks for coming along with me to Colorado Springs Health Partners. And with me is Dr. Kendra Robinson. Welcome, Doctor.
Thanks for having me.
What is Colorado Springs Health Partners?
So Colorado Springs Health Partners is the largest physician-owned multi-specialty organization in Colorado Springs.
Wow.
So we've got 11 locations and we have over 100 providers and over 20 specialists in our group. So a lot to offer.
Yes.
Yeah, and we have our own ambulatory surgical center, so any sort of day surgeries or procedures we can certainly do through CSHP, and have a wonderful radiology program, so any sort of imaging studies we can really offer anything that might need to be done. We're on an electronic health record and have been since 2003, so we're very up and coming with that, and that's really handy. You know, if you need to send something to the pharmacy, you send it right away. If I want to send you to a specialist, I see the report right away, and it just really keeps everything together as a whole for your entire health care.
Wow.
Yeah.
Very good. Very efficient. With all of these different doctors we can select from, really.
Yeah.
How will I know I have the right one for me?
Yeah. So first, obviously, you want to check with your insurance carrier, you know, who do they cover? And that will narrow it down a little bit.
Yes, it will.
Medicare patients, you know, there's usually a published list, or you can call different offices and see if they take Medicare. We do at CSHP. We take mostly all insurances, really. And then maybe check for gender if you like a certain female or male provider. Obviously, location, close to your home or your work. And then there's different providers. There's a DO versus an MD. And there's nurse practitioners and PAs.
Okay, let's go back to that
Sure,
DO.
sure.
What is that?
Sure.
What's the difference?
Yeah, so I actually am a DO, and that is a doctor of osteopathy. And they're trained really with the same medical background, completely the same licensed physician. But I think the underlying training and the philosophy of our training is a little bit different. We're also additionally trained a little bit in the musculoskeletal system, so we actually get additional training in that regard. And some DOs do what's called manipulative medicine, where we actually treat with our hands and diagnose with our hands as well. So you'll see that with an osteopath. And we think more about kind of a holistic type of view, you know, looking at the person as a whole and really trying to put everything together as a whole person and not just treat them as a disease process or symptoms.
Okay, so there's that possibility of the DO or the MD, and there's the physician's assistant.
And PAs work under physicians, but they're fully capable to take care of any sort of common medical problems that you may have. They're also very helpful if the physician is busy. You can usually easily get in with a PA. There's also nurse practitioners. Those are independent licensed practitioners, and they're also very capable and really do a great job of taking care of our patients as well. So it's always another option. And then looking at specialty, you know, an internist versus a family doctor. A family doctor can take care of patients from birth to all ages. An internist we call an adult doctor, and so they see patients 18 and up, usually more elderly patients or more chronic disease processes, lots of medications, more complicated issues. And so choosing the right provider for you is just kind of what you can do.
Now, is there a shortage of the family doctor now?
These days, primary care is becoming a shortage, and I do think that's the nice part about osteopaths is over 60% of osteopaths are in primary care. So that's family practice, internal medicine, pediatrics, and obstetrics. So we're trying to really fill that void, but certainly, you know, that is a void. That's unfortunate, but we're trying to train more of our up-and-coming physicians into primary care.
And so, after seeing maybe a family doctor, might send you to a specialist, and there are numerous specialists in your system.
Definitely. We really have almost all specialties that you could need, and if it's an additional specialist, we've got very good ties with everybody else in the community. So.
Lots of options for good medical care.
Yeah.
All right. Well, thank you very much, Doctor.
Thank you.